Call the member for Melton.
Thank you, Acting Speaker. I rise today in support of the Human Tissue Amendment Bill 2020, and I'm pleased to rise and follow the member for Ivanhoe and the Parliamentary Secretary for Health, who has made a fantastic and important contribution. I'd also like to acknowledge the great contribution from the member from Footscray and her personal experiences in working for Donate Life. Once again, we've seen this government's commitment to the health and well-being of all Victorians, and this is just another example of the Andrews Labor government's innovation to ensure the best health outcomes for Victorians. I want to thank the Minister for Health and his staff for this amendment bill. As many of you know, I've spent my career in the Ambulance and Paramedic Services. There are very few of us who really see the impacts of accidents and medical issues and the flow-on effect it has on families and loved ones. Organ donation is one of the most important things that we can do as an individual, and is also one of the easiest things we can do. When we choose to make ourselves an organ donor, that decision can have huge impact on the lives of many people. It can also be a very selfless act, not just to give the other people, but to take away the pressure placed on families to make a tough decision when the emotions of potentially losing a loved one runs high. Registering as an organ donor means you're registered with Donate Life. Donate Life have a wonderful team of caring, hard-working nurses, donor advocates and facilitators that tirelessly work behind the scenes in an emotionally and often fast-paced environment. Your decision to be an organ donor can make their job so much easier and increases the chances of a successful donation. For most organ donations to be viable in Australia, the situation must be just right for those organs to be viable to allow successful transplantation to occur. Often this means the availability of specialist medical equipment to ensure organs remain viable. Organising a transplantation is a huge effort. There's huge amounts of testing and paperwork. The clock really is ticking, and usually in a very emotionally charged state when families are having to make and to come to grips with a tragic accident or event. I had experiences as a flight coordinator at Air Ambulance Victoria of arranging for transplant recipients to be flown into Essendon Airport and then transported to either the Royal Melbourne, the Alfred, the Royal Children's or the Austin hospitals to have their surgery. We also arranged for organs to be flown to Melbourne to be provided to transplant recipients, and that practice still happens today on a daily basis. To see a patient arrive at Essendon Airport on death's door and then 2 to 3 weeks later depart to go home to rural Victoria or southern New South Wales was amazing. Sustaining someone's life and enhancing their quality of life cannot be measured in any monetary amount. The value of that individual, their family, friends and their community is immeasurable. In January 2004, I had a personal incident with my twin brother, Warren, where he went into cardiac arrest while playing basketball. He was dead before he hit the floor. Fortunately for him, I was playing that night. I commenced CPR with an opposing player who was an off-duty nurse. My brother was lucky. He got good CPR. MSAC had an automatic defibrillator where he was defibrillated, and the ambos arrived quickly, who treated and transported him to the Alfred Hospital. His young son witnessed all of this. He walked out of hospital a week later. 16 years later, he's still alive and giving life a fair nudge. That outcome has made a major difference to his family and community. I use this as an example of how this legislation can change many lives and quality of lives, and I believe that should be all of our priorities. I use my family experience just to show how incredible it is to sustain and extend someone's life. Statistics from Donate Life show that those who made the decision to be an organ donor results in higher donations. The conversations that the hospital staff and the Donate Life team have with families of potential donors who have registered as an organ donor means that a successful outcome is easier to achieve. Discussing with a family member that this is a decision their loved one had made and asking for their consent is a vastly different conversation to asking a family member to consider donation. 90% of families say yes to donation when their loved one is a registered donor. This compares to the national consent rate of 62%. In Australia, we always ask family to confirm the decision of their loved ones, but a conversation with the family to say this is what your loved one had already chosen is, of course, a lot easier. It is always a tough decision considering a person is going through an already traumatic event to make another very tough decision. It's important to note that the people who are having the discussion with family members about potential organ donation are not those treating their loved one. The decision to donate life is never a decision to stop treatment. The professionalism and treatment by the doctors, the nurses and hospital staff is unquestionable. The easiest thing that you can do for your loved ones from a situation like this is to jump online with the Medicare card number and take 2 minutes to fill out an online form to tell people that you choose to donate life. Around 1,700 Australians are currently waitlisted for a transplant, and more than 12,000 people are on a dialysis. If we can increase even slightly the rate of organ donation, we can have a huge impact, not just on someone's life expectancy, but the quality of life. So make sure you do it. If you are listening now, jump online and register at donatelife.gov.au. My preference would be that we have a system of opt-out of donating organs and tissue in this country, and I think this is an issue that we should have public debate about. I acknowledge the member for Brunswick on this very issue in his contribution. Surely the saving and the improving of the quality of health of individuals should be a priority in this very affluent country. It can be easy to think about life in terms of years saved when it comes to organ donation, but we should consider the quality of life gained by organ and tissue donation. Time not receiving treatment or dialysis is time at home with those they love or living a more fruitful life. It has a transformational impact on not only those receiving a transplant, but those who surround them. In Victoria, our donation rates have been very successful, but there's always more that we can do. We should never leave no stone unturned in the pursuit to try to increase the rates of donation. One suitable organ donor can result in multiple organ donations to multiple recipients, even more if tissues are also donated. For those who receive organ and tissue donations, it's not just an increase in the years, it's an increase in the quality of life. Traditionally, the most common organ donations came from donors who suffered brain deaths. This would often occur in ICU or emergency wards, where life support could make sure that the donated organs remained viable. Victoria in particular has recently seen an increase in organ donation through increasing donations from donors who pass away from circulatory death. These deaths do not result in multiple organ donations that are viable from brain deaths, but have given a new quality of life to the recipients from organs that might not have previously considered. Some of this change has come from new medical research and technology and new practices. And as technology and medical research increases and develops, it's important to make sure that our legislation is up to date to keep pace with these changes. Relying on the legislation that was written in 1982 is no longer appropriate. We now have modern medical solutions that were never dreamed of in 1982 when the Commodore 64 was launched and the first CD was sold in Japan. The Human Tissue Amendment Bill 2020 will amend the Human Tissue Act 1982 to include a process for the authorisation of ante-mortem procedures in relation to a person so that donation of that person's organs or tissues can occur after death. It allows the transplantation of organs and tissues to another person after the death of the donor, or for the use of that tissue for other therapeutic or medical or scientific purposes after the death of the donor. This concept may not have been envisaged by many people in 1982. We only focus on organ donation and easily lose sight of tissue donation. Once again, we need to view donation of organs and tissues about increasing the quality of life of patients. The Victorian Institute of Forensic Medicine operates the Donor Tissue Bank of Victoria. It was the first multi-tissue bank in Australasia. It screens, processes, stores, tests and distributes multiple types of tissue all at their facility in Southbank. They provide Australian surgeons with safe and effective tissue grants for transplantations in many medical areas. Their technologies and skills are truly amazing. Tissues donated through the Donor Tissue Bank of Victoria often come from deceased donors, many of whom were not able to donate their organs. Medical products that have been developed have come from amazing medical research that once again would be in the realm of science fiction in 1982. We as a government need to make things easier for facilities like the Donor Tissue Bank of Victoria. We should never underestimate the potential of one small decision can have for many people, their families and their communities. I support this amendment bill and I commend the bill to the House. Thank you.